This study is it's an updated results of the phase 1b study of isatuximab in combination with bortezomib, lenalidomide, and dexamethasone in patients that are non-transplant eligible or without no immediate intent for transplant. In fact, what we are doing here is to evaluate a new form of infusion of isatuximab as a fixed volume infusion. Yes, so this is, as I said, for transplant ineligible patients, and they are treated with a quadruplet, isatuximab, bortezomib, lenalidomide, and dexamethasone. They receive 4 cycles of VRd of 6 weeks, each of them, and in combination with isatuximab. There was a part 1 in which isatuximab was administered as the standard weight-based infusion. But subsequently, in the part B of the study, 46 patients were treated with a fixed volume infusion of isatuximab. That means that we have, they all receive the same volume, 250 milliliters, what makes it more easier to administer, and probably a decrease in the duration of the infusion. Yeah, so the key findings of this study is that we are evaluating this quadruplet combination and with this novel way of administration of isatuximab. The first important point is that we clearly decrease the time of infusion for isatuximab, particularly in the second and the subsequent infusions. It was for part A with the usual way of administration, and part B was similar, so almost 4 hours of infusion, but it went down from these 4 hours to 2 hours in the second infusion and 1 hour and 20 minutes for the third infusion. And that really indicates that we are able to shorten the infusion duration in 1 hour from the initial way of infusion. The second important point is that this way of infusion and this quadruplet really is safe and is well tolerated for these patients. We have few patients that are out of study due to adverse events and related to the medication. There are some of them, but some of them are non-related with COVID disease, with diverticulitis, with some secondary malignancies, probably all of them non-related to the treatment. So it is quite well tolerated with very few treatment-emergent adverse events, non-hematological and grade 3-4, so it was quite well. And there was some hematological toxicities, but I think that they are well managed with the dose reductions and discontinuation in some cases. There was also, I think it's also very important to focus on the infusion-related reactions, and also with this type of infusion that as we are decreasing the time, and also we are improving the management of these infusion-related reactions. In the part A, the previous one was 52% of the patients have infusion-related reactions in the first infusion, and we went down from this 52 to 22 with a fixed volume infusion that we are now evaluating. So again, it speaks about the good tolerability of this method. And finally, of course, we have to speak about the responses and the efficacy of this quadruplet. As I said, isatuximab VRd quadruplet in elderly multiple myeloma patients. The overall response rate was 98%, with 53% complete response. That is, in fact, the primary endpoint of the study. And also, interestingly, almost 50% of the patients, 42% of the patients have achieved a complete response that was MRD negative, so immunophenotypic complete response. So, well, good tolerability, convenient for the patients, and also, I think, with a very good efficacy. Yeah, so we are now in young patients with multiple myeloma that we are now focused on. We are now using a lot of quadruplets and these anti-CD38 monoclonal antibodies in combination with VRd or VDD, now moving to VRd. For non-transplant eligible patients with elderly patients, but we are also incorporating the anti-CD38 monoclonal antibodies in this scenario, but mainly in triplets. I think we are now, this is one of the first data we have with a quadruplet using an anti-CD38 monoclonal antibody, isatuximab, in combination with bortezomib, lenalidomide, and dexamethasone. So it's like a full schema for these elderly patients. And even we have here patients with up to 87 years old of age. So quite elderly patients. And here we demonstrate that it's feasible to use this quadruplet. Probably this is not for everybody, for all these elderly patients, but at the end we will have to demonstrate or to define which patients, which of these elderly patients would really benefit from a quadruplet. That, as I said, it's convenient, easy, safe, and also effective.